Bigger, better, bolder. The cold, hard truth is taking talk to the next level. Right here on Bobo 89.1 FM, Cayman's Community Radio. We are still spilling the tea and committed to being part of the change that Cayman so desperately needs. Join Sandy Hill weekdays from 7:30 a.m. for Premier Access, Cayman Voices, Truthful Thursdays, and much more. Cayman's #1 talk show is now bigger, better, bolder, and more than talk. Getting results with hot topics, consumer reports, court exposés, and more.
I've come to set the record straight. I've come to shine the light on you. Let me introduce myself. I am the cold, hard truth.
Now, from the CMR studio in Grand Cayman, live, direct, it's the cold, hard truth. Now, join the conversation on 345-936-2626.
That number again is
345-936-2626.
All right, folks. Good morning. Good morning. Happy Tuesday. How is everybody doing? I know you guys are all tuning in. I see you over there on Instagram, Facebook, YouTube. Who else do we have? Oh my gosh, all over the place. Everyone is tuned in this morning. We will be bringing some weather updates. And of course, we will most certainly be checking in terms of what's happening in Jamaica. So please bear with us. We do have guests in the studio this morning, but we have got some details, and we're certainly going to be touching base with our partners in Jamaica to see exactly how things are going. So, lots of concerned persons this morning. We have gotten some initial preliminary reports, and we are waiting to get even more. So just bear with us as those reports start to trickle in. But of course, today is Tuesday. And so we get to have, how they say lunch and learn? Well, I like to think this is breakfast and learn, although most of us are just sipping tea in the mornings. We're not even eating food, but that's okay. We are here with Health City Cayman Islands. And today, yet another really, really important topic, World Stroke Day. So we're going to be talking with Dr. Ramneesh, who is a consultant interventional neurologist, and Shamari Scott, who is the chief business officer. So let's go ahead and bring Shamari in first. Good morning, Senor Shamari. How are you?
Good morning, Sandy. Good morning, Sandy. First of all, prayers and thoughts with our brothers and sisters in Jamaica.
Yes.
It's Category 5. We understand how devastating Ivan actually was to us. So we can only imagine, the damage, and hopefully there will be limited loss of life. I already saw in preparation a few lives were lost, unfortunately. And just, stay ready and able to help not only Jamaica, but it looks like it's going to go through Cuba and another one of our sister countries, Turks and Caicos, which is also low-lying in many areas and small, kind of like the Cayman Islands. So hopes and prayers that the storm, reduces in magnitude and doesn't do too much damage as it passes the Caribbean. Hopefully it speeds up. That's the worst thing as we would know, when it sits over you. So definitely thoughts and prayers. And I'll be listening in to hear all the updates that you'll have from people on the ground as well.
Definitely. Well, thank you so much for that, Shamari. Lots of interest watching the situation across the region. So any good news for us this week?
So it's good news in that we demolished the Atlanta Falcons over the weekend. But for me, it's a fast road to nowhere. We're at the point now where they just need to lose these games so that we can get rid of everyone and not give the owner a reason to actually
hang on to hope
and say one more year. No, it's done. Get rid of the GM, get rid of the head coach to start. Let's gut it. Let's start over. I saw a t-shirt that somebody sent me and I was like, buy it for me. That said, rebuilding since 1974. The Dolphins drive me to drink. So, that's a shirt I need. So we've been in rebuild mode for a while, but hopefully they do what's necessary and we can start back on the right foot. We have a few good pieces that we can build around, and let's just gut it and start over. So that's my update from the Miami Dolphins. But we won, but now it's bittersweet because it's at the point in time where I don't think we're going to make the playoffs. So let's go ahead and restart. Because this experiment with the current head coach and GM is definitely failed. But that being said, today is an exciting day. October 29th is World Stroke Day. So the theme is every minute counts. And you mentioned that we will have Dr. Romnish on here, and he likes to talk about time being brain, which is true, in that, strokes are a true emergency. Every passing minute makes a difference between life and death, as well as disability and quality of life. And Dr. Romnish will be able to speak about the rapid recognition and treatment. You can save up to 1.9 million brain cells every minute after a stroke, which I think is remarkable. But seeing as Dr. Romnish is there, I always joke with him that it's better to hear him than to see him. But, I'll talk about Dr. Romnish. He's been with us. He's our consultant interventional neurologist, and we call him our Health City Marl Road. If there's anything to know about anyone within the staff or anything within the Health City community, you just go to Dr. Romnish. He seems to know. So you have a clone in Health City that knows everything that's happening.
Nice. I love it.
But he's been with us since 2016. His clinical focus is on stroke and interventional neurology. He did his residency in neurology. He's also very experienced in advanced neurovascular interventions. He has a strong academic background, published extensive peer-reviewed journals. At Health City, he has actually led several pioneering initiatives, including the establishment of a dedicated multiple sclerosis treatment center. He's also performed quite a bit of firsts. So even though he came just a little bit after we started, 2014, Sandy, we started, he came 2 years after that. He's done first of the kind procedures in the Cayman Islands, such as the first mechanical thrombectomy for acute stroke, first flow diverter for intracranial aneurysms, first arteriovenous malformation embolism called AVM, first dural fistula embolization, as well as the first bypass surgery for giant middle cerebral artery aneurysm. So I hope I didn't butcher that too much, Dr. Romnish. But also with those clinical achievements, Dr. Romnish has played a vital role in developing Health City as a stroke-ready hospital, incorporating advanced technologies, including artificial intelligence, which we will definitely touch on today. And he recently was at the local healthcare conference that just happened last week, and he wowed people with our artificial intelligence and the rapid stroke ready program that we have that he'll touch on today. And he also has, enhanced diagnostic precision that improves patient outcomes. He's also helped Health City as an entity to be able to do that as well. So that's just to give you a little taste of who Dr. Romnish is. You would already know him. It's such an important area, and that's why we're so happy to have him on the show today.
Well, good morning, Dr. Romnish. How are you?
Good morning, Sandy. Morning, Shumari. Thanks for the introduction. I'm doing well, thanks.
Yeah, so we've got your post-retirement plan already all set up. You'll be joining the CMR team.
Yeah.
have you on the ground getting all the latest for us. That's wonderful. In the meantime, though, you have some important work yet to do at Health City, Cayman Islands, talking about World Stroke Day. This is one of those that I tell you, really is pretty scary because, I feel like we're all at risk and there's certain things that will definitely make us more at risk. So it's being observed annually on October 29th to raise awareness about strokes, its prevention, and the importance of timely treatment. So the theme this year, as Shamari just mentioned, is every minute counts. And I know for a fact with most medical things, every minute counts, but especially with strokes. Tell us why that's the case. Why is it that every minute counts?
Yeah, so stroke is a medical emergency where the blood supply to the brain has been compromised. It occurs either because of a blockage of the blood vessel or because one of the major vessels has ruptured. So basically, there are two types of stroke. One is ischemic, where the artery gets blocked, and the other is hemorrhagic, where the artery ruptures. Ischemic strokes account for about 80% of all strokes. The hemorrhagic strokes are less common. Treatment is now available for ischemic strokes. If you go back historically, actually before 1996, there was no effective treatment for stroke. And since 1996, there's been a revolution in the management of acute ischemic strokes. The reason why it is important, and we keep advocating this, every minute counts, time is brain. As Shumari said, that every minute the blood supply to the brain is compromised, 1.9 million neurons will die. The sooner we intervene or restore the blood supply to the brain, the better the outcomes. Initially, the window period or the golden hour was between 3 to 4.5 hours. But now, using modern imaging techniques and AI, we can actually extend the window period to 24 hours and beyond. But having said that, again, the sooner we intervene, the sooner the blood supply is restored, the better the outcomes.
This is really good news, that there are treatments that can actually, in some instance, save a person's life, and in other instance, practically reverse the ill effects of a stroke. So we're going to get into some of the details of that here this morning. But rapid recognition and treatment can save up to 1.9 million brain cells every minute of a stroke. That's shocking, really.
Yeah, it's huge. And again, as I said, the sooner we intervene, the better the outcomes. Using this newer technology, we are seeing better outcomes and less complications in patients who we treat. But again, the recognition of symptoms of stroke have to be made, people have to be made aware of. The best way to recognize the symptoms of a stroke is the acronym BFAST. This basically stands for, B is for balance, where the patient suddenly becomes imbalanced. E is the patient develops some kind of visual symptoms, either double vision, blurring of vision, or loss of vision. F stands for face, where the face becomes asymmetric. You ask the patient to smile, one side of the face will droop. A stands for arm. You ask the patient to lift the arms out in front of him, one arm will drop. S stands for speech, where either the patient has difficulty in speaking or he has difficulty in comprehending what's told to him. And T is time to call 911. So this is very important that the public recognize the symptoms of a stroke, so that if they see someone who's having these symptoms, they can call 911 and get him to a hospital, where the sooner he gets in, the better the outcomes would be.
And so, I mean, I hear you with this, and I'm thinking to myself, that means that people around you should be adequately prepared to recognize the symptoms of a stroke. Yes. Because if they recognize it, they could potentially save your life. I mean, obviously, if the person is in a position to recognize it themselves, depending on how bad it is, then certainly, they can try to get themselves help. But is it most cases that other people recognize that something is off, that something's happening?
Yes. So generally, it will be quite dramatic. The patient will be walking, talking, and suddenly slumps to the ground or loses speech. So generally, yes, the people around the patient would recognize the signs and symptoms of a stroke. Sometimes, if it is a minor stroke, the patient may recognize the symptoms himself, whereby one side of his body goes numb, and that would bring the patient to the hospital. Unfortunately, in some cases where it's a minor stroke, we see this especially in young people, they tend to neglect the symptoms. They feel that it'll pass, they just need to sleep and get up in the morning and everything will be fine. This can be quite devastating. So, which is why, again, it's important that even if you suspect, even if you feel the symptoms are minor, it's best to go to the hospital and get the necessary tests done as soon as possible.
And we do have a sample video. So, folks, pay attention to this. I thought this was a very impactful video when I was previewing it yesterday.
What's your emergency?
So Shamari just mentioned the fact that there is revolutionary new technology that is available. And we see that this video talks about the stroke AI. What is that?
So before, what would happen is if we had a patient who came in with a stroke, the traditional stroke pathway is the patient, the EMS would inform us their en route with the stroke patient. The patient would be evaluated by the triagist. They would evaluate how severe the stroke symptoms were. The patient would then be sent for imaging. The imaging would then need to be reviewed by a radiologist, and we would have to wait. So basically, what they showed is it would take about 60 to 65 minutes from the arrival of a patient to the door by the time a decision was taken on whether the patient is a candidate for thrombolysis, is a candidate for thrombectomy, or what needs to be done. This is basically because we need to rule out certain things before we take the patient for the procedure or give him a thrombolytic therapy. We need to rule out that the patient has not had a bleed in the brain, because if we give a blood thinner, that could actually worsen everything. We need to identify exactly which blood vessel is blocked. And we need to make sure that there is still viable tissue so that to justify taking the patient for such a procedure. So this is why it would take about 65 minutes before a decision was taken, because we would have to wait for the radiologist's report. He would have to review it. We would review the scan. So now what has happened is we have this new software called Rapid AI. It is an artificial intelligence-based software which is FDA approved. So now what happens is when we have a patient who comes in with a stroke, the triagist will evaluate the patient rapidly, and the patient will be put into the CAT scan. The CT scan will be done, and within about 3 minutes, we get all the information we need. That is it an ischemic stroke? Is there any evidence of bleeding on the scan? Which blood vessel is blocked? And finally, is he a candidate for mechanical thrombectomy, or should he be managed with IV thrombolysis? So it has improved time outcomes significantly. The last time the patient, we got him into the cath lab in about 30 minutes. So he came into our ER, the CT scan was done, we got the information, discussed with the relatives, he was taken for thrombectomy, and he's made a complete recovery. So this is where this AI has helped us. It's helped us eliminate a lot of steps in the traditional stroke pathway.
Wow. I mean, and like you said, every minute certainly becomes extremely important. So some of the symptoms, and Anthony has a question here. He wants to know, can you ask, is there an age indicator for stroke? Is there something seen in adolescents or juveniles or just adulthood? Well, I know that we're seeing it in younger and younger people, but are children, immune from having a stroke?
No, so children are not immune from having a stroke. It's not common. The youngest patient I had seen back home in India was 7 years old when he had a stroke. That's because he had a dissection or tear in one of his arteries. I think he was playing something and he had a violent neck movement, which is what caused the artery to tear. But children are not immune, but they're not common in children. And yes, as you said, strokes can occur at any age group. The youngest patient we've intervened on island is 18 years old, and but you do see it more commonly in elderly people. So traditionally, above the age of 70, the incidence of strokes are common, more common.
Wow. Okay, and we're going to talk about some of the factors here, some of the risk factors as well that you should really be trying to monitor, folks. But we do have a testimonial from someone who has actually, been through this. So let's have a look at this. Very, very interesting testimonial this morning.
Stroke on the radar at all. I would say, zero awareness. I was, just thinking to myself at my age, I was 46 at the time, that I lived a relatively healthy lifestyle. I mean, my diet was good. I exercised regularly. I didn't have high blood pressure. I didn't have cholesterol. I didn't have diabetes or anything that could have made me aware that I might get a stroke. I was actually traveling back home. So I was on the other side of the Atlantic in London when I first had symptoms, and I was staying overnight in an airport hotel. And I woke up in the morning to catch my flight, and I realized I didn't have full control of my left arm. I couldn't function the same as I did the night before. And the only next time I noticed any kind of symptoms, I suppose, was trying to put my jacket on when I landed in Cayman. And I realized my left arm was hard to put through the sleeve of the jacket. But again, I just needed to grab my hand luggage and get off the plane. So I just got into a mode of just get home. I woke up in the middle of the night to get a glass of water. And that's when I noticed my balance was completely off. I found it difficult to walk. And I actually, in the process of getting a glass of water from my kitchen, I dropped the water.
911 was called. He was taken by ambulance to the Georgetown Hospital. They noticed and recognized that Sean was having an acute stroke.
I was stuck in Sweden with the girls, and we obviously didn't know how serious it was. But I spoke to him when he was in Georgetown Hospital, and at that point I could tell it was getting more and more serious because he didn't really sound like himself.
When Sean came to us, he was conscious. He was able to respond. His eyes were deviated to one side. He was not able to move the left side of his body at all. We activated what in our hospital is known as a stroke protocol, which every acute stroke patient undergoes. He was immediately taken for imaging. In the imaging, what we noticed that even though he was not in the traditional window period, there was still a large area of his brain which was still salvageable, as in it had not been damaged completely or irreversibly.
And it was quite quickly decided it was going to do the surgery to remove the blockage.
After 3 or 4 days in the ICU, I was moved to another room where at that point there was a bit more of a focus on getting my movement going again.
He showed good improvement, but we wanted a more intensive rehab program, or rather an inpatient rehab program, and which is why he was then shifted overseas for that.
When Sean got moved to Miami, the girls came with us or Ebba, the oldest daughter, she went back and forth because she still wanted to continue school here. And the little one, Alice, she came and she was, super supportive. She was with us the whole time. We went back and forth to the hospital 2 to 3 times a day to be with Sean and help him with the recovery. And she assisted wherever she could, anything from putting socks on, doing his buttons, itching his face, whatever it could be.
Everybody has had to play a part in helping me in the recovery process. Initially I had to be driven around to appointments and all those kind of whatever it was, physical therapy and all these different doctor's appointments that I had to make in the early days. Well, I've been telling so many people locally how blessed we are, how lucky we are to have a facility like Health City on the island, because I don't know where I don't know if I would be here without it, to tell you the truth.
So it's super important for local healthcare providers and practitioners to support patients with stroke recovery. Sean had intensive neurophysiotherapy and rehab in Miami and then came back to the island, and these services need to be continued for him to enable a full recovery. So when Angelique first came back to the island with Sean, she found it very challenging trying to piece all of the specialties together. So with the combination of the Cayman Heart Foundation, they both worked together and they came up with a huge list of great providers, including neuropsychologists, occupational therapists, physiotherapists, golf instructors, yoga instructors, Pilates. And it was those collaborations that have helped Sean to get to where he is now, obviously in combination with his sheer hard work and determination and the support from Angelique.
He's made a fantastic recovery. He's currently able to walk. He's independent for everything. He's back to work.
And I am making sure that, I'm taking all the necessary medications and eating healthy, and there is some fun in there as well. I've taken a real passion for golf. I mean, I've always played golf, but golf is a game that I could actually get back to, get better as I play more. Right now I notice I can feel improvements each time I play. So once a week I'm on the golf course. The most profound thing that has come out of this experience for me has been the realization of kind of how fragile life is and how you really have to make the most out of everything. How every day, every relationship needs to count.
What an amazing story, Doc. I mean, wow. Lots of resilience in there, immediate medical intervention, and the recovery period can be long and challenging.
Yes. Sean's case actually shows us that in spite of it being delayed, I think we went in almost 24 hours later because his symptoms occurred while he was in the airport. He caught a flight, came into Cayman, went home, and subsequently came the next morning. So there was a significant delay. But again, it shows why it is so important to recognize the signs and symptoms of a stroke. And also now that with improved technology and improved interventions, we can intervene even later on. But again, the important message is that the sooner we intervene, the better.
Mm-hmm. Yes, for sure. Quite an inspiring story. And as he said, it's about appreciating the little moments in life with your family. And what I found interesting is that when he talked about, he didn't think that he was at risk at all. Let me ask you trying to see if we have a risk sheet here, but what are we looking at when we're talking about risk? What puts someone at risk for these different types of strokes? I know some are just unavoidable, right? They just happen no matter what. But there's a good deal of risk involved in your lifestyle. So we know all the same things that we talk about for, cholesterol, coronary heart disease, all these other things increase your risk of stroke. So diet being extremely important. Lack of exercise also being extremely important. Having a sedentary lifestyle is leading to, a lot of the diseases now that we're facing. But is there anything else that stands out in your mind when it comes to stroke prevention?
So the main thing, as you said, we look at risk factors as modifiable and non-modifiable. Non-modifiable being age, sex, race, ethnicity, genetic predisposition to strokes. The modifiable risk factors, as you said, are blood pressure, high cholesterol, diabetes, obesity, smoking, alcohol. So these would be the modifiable risk factors which increase the risk of someone having a stroke. In some people, we'll never find out what has caused the stroke. As Sean said, he was very, very healthy. Absolutely no risk factors. We still till today don't know what caused the stroke.
Wow. Yeah. So the only thing you can do is just treat it the best possible way, and with the amazing technology that's available. That certainly is a good outcome. Anthony says, good information. I didn't know that. So that's why we have these segments, Anthony, because trust me, there's so much that we just don't know, and it's good to learn. Good morning to Jazara. We have Strong Will. It says he's my dad's doctor. Yes, lots of people know Dr. Ramneesh. And Tracy Watler also says he is a very good doctor. So some of your patients and their family members speaking to your amazing skills here this morning, Dr. Ramneesh. So quickly restoring the blood flow to the brain, that's important because obviously that's what's causing the stroke. Now, if you have, and unfortunately I know of some very young people who've had this, where you just have, let me look at my notes here and see which one that's like the immediate rupture. That's the hemorrhagic,
yes.
Hemorrhagic.
Yeah, hemorrhagic. Yeah.
Stroke. Okay. So that's where a blood vessel, for whatever reason, just breaks open. And that apparently can be so immediate that that's it. There was no chance at all, right?
So that the most common cause is what we call as an aneurysm. An aneurysm is a weakening in the blood vessel wall. It tends to bulge and balloon, and it is at risk of rupturing. Of these people who have an aneurysm which is ruptured, only about 20% of them actually survive it.
Wow.
Okay.
So that one's pretty less common, but also the most deadly.
Very, very good. Yes, it's very, very deadly. The risk factors, again, remain the same: high blood pressure, smoking, genetics. We do see a family history in aneurysms as well. So if one member has an aneurysm, it's better to screen family to see that there are no aneurysms. The treatment of aneurysms, when they are ruptured, they immediately undergo a procedure known as either endovascular coiling, where we go and put coils into the aneurysm and block it off. And the other one is where my surgical colleague would do what is known as clipping, or put a clip across the neck of the aneurysm. But as you said, these are far more devastating and extremely challenging to treat.
Yeah. So just last week, a couple of days ago, in fact, I'm going to show you this image. I want you to tell us your thoughts on this. I posted something about the fact that Kim Kardashian said that she actually had an aneurysm. And I hadn't heard about this, but apparently in the latest episode of the Kardashian, it comes up. And she says that she had a brain aneurysm, and she blames a stressful divorce, because apparently there is a link with aneurysms and stress. So she found out, because, they're always getting every part of their body scanned. And I guess as part of her sort of checkup, she did a routine MRI. I don't know how routine MRIs are for no reason, but she did a routine MRI, and they actually discovered that she'd suffered what she puts in a little aneurysm. And so sometimes we have them, I suppose, and they don't really do anything apparent to you.
Absolutely. So aneurysms, as I said, can be two types: ruptured and unruptured. We do find these when we screen patients for things like headaches, migraines, that kind of thing. Every aneurysm does not need to be treated. There's a certain criteria which we go by when we decide which aneurysm to treat. Some aneurysms we would follow up with serial scans to see if they are increasing in size or if their risk of rupture is high. Actually speaking, the AI software which we use helps us to actually detect the flow within the aneurysm, whether it has a risk for rupture, and whether it needs to be treated, and also what is the best method to treat it. So would it be clipping, where in endovascular, where we put things like flow diverter stents, etc., to treat these aneurysms.
Pretty amazing. And it's good to know, because it's not something you necessarily will spend a lot of money go searching for if you're not having any symptoms normally.
True.
Yeah. All right, folks. Any questions? 936-2626. Phone lines are definitely open. And of course, you can also send us messages via WhatsApp, because sometimes people are a little bit shy. So treatment options, medication. Which of the types of strokes respond best to medication?
So ischemic strokes respond best to medication. There's a clot buster which we give within the first 3 to 4.5 hours of onset of the symptoms. This helps to dissolve the clot. So again, ischemic strokes respond the best to medication. For hemorrhagic strokes, it's to prevent complications related to the bleeding, be that brain swelling or spasm of the blood vessels. Those are the kind of medication. But again, the main treatment is for the ischemic strokes, medication-wise.
Okay. And then interventional procedures, what does that include?
So this is where where the software would tell us that there is a blood vessel which is blocked in the brain. We would then enter minimally invasively and go and retrieve the clot. Okay, so that is, we use what is known as a stent retriever, where the clot is physically pulled out, or we also use what is known as a penumbra device, which is a suction catheter which engages the clot, and then the clot is removed.
All right. And surgical procedures, obviously, that's a bit more invasive.
That is more invasive. Again, that would go more towards hemorrhagic strokes. So that would be clipping. Sometimes if the swelling within the brain increases, a procedure known as a decompression, where part of the skull flap is removed to allow the brain to swell and not compromise the other side.
All right. Live Happy has a question. Says, sorry, I tuned in late. What should we do if someone is having a stroke? So the first thing I'm assuming is call 911.
Exactly. Call 911, get them to a hospital, and the sooner the better, always.
Yeah. Because the medical professionals can do what needs to be done. The sooner the better. Yes. And rehabilitation, as we've seen from the testimonial there, can be a very long and arduous process, but it is something that, you have to kind of fight through and you have to do to try to get your full mobility back and a decent quality of life.
Absolutely. So rehabilitation is the most important after all of the medical interventions are done. In the ideal setting, after the patient is thrombolized or has a mechanical thrombectomy, he should be moved to a stroke ward for observation for 24 to 48 hours. If everything is stable, then he should be in an intensive inpatient neuro rehab program. So this includes physiotherapy, occupational therapy, speech and language therapy, and also counseling and things like that. Unfortunately, in Cayman, there is no inpatient neuro rehab, so we do have to send most patients overseas for that.
So it sounds like there's still some room here for improvements on the rehabilitation side.
Yes.
And I guess over time, hopefully those things will come. Why minutes matter. So let us just review again the reasons why every single minute matters when a person has had a stroke.
So stroke, as I said, is basically an interruption to the blood supply of the brain. This can be either due to a blockage or rupture of the blood vessel. The brain cells immediately start dying as soon as there's compromise. This damage is usually irreversible, and it needs to be treated quickly. We cannot reverse the damage which has happened, but we can prevent further areas of the brain from getting damaged. Early intervention, we always say 4.5 hours, which is still the most important time. And we've shown that if we can intervene within the first 60 minutes of a stroke, we've actually seen the patient walk home even the next day.
Wow.
So the faster the patient reaches a stroke-ready hospital, what that means is a place where you can give either a clot buster treatment or do a mechanical thrombectomy, the better the outcomes are.
Wow, fantastic. And prevention. So again, making sure that you're aware of your numbers. I can't stress that enough because, I was saying this last week when we were talking about cholesterol and so forth, but there's now good evidence that although you may be within range, so, you might not have diabetes yet, you might not have high cholesterol, just the fact that they are increasing is an indicator that you need to make some lifestyle changes because that increase alone can put you at risk. So, make sure that you're aware of what your blood pressure is. It's called a silent killer for a reason. A lot of us walk around with high blood pressure and we simply don't know it. So, get your little home monitors and you can actually track it. I do that. You can track it on your app, on your phone, because most of us can't go into a doctor's office every single day, but you can track it different times a day because the blood pressure apparently fluctuates by the second, really. So it's good to know what your numbers are, especially waking in the morning, doing activities throughout the day, and even before you go to bed. Maintaining a healthy lifestyle with regular exercise, balanced nutrition, avoiding smoking and excessive alcohol, because again, smoking obviously constricts the blood vessels. There's in no world, I don't care what parallel universe you may live in, there's absolutely no world where smoking is good for anything. It doesn't really help you with stress. It probably stresses you out more, but it's like bad for every single part of your body. So, I can't stress that enough. And of course, they're realizing kind of the same thing with alcohol, to be honest, as well. And then, of course, doing those routine executive health checks, especially if you're over 40 or you have a family history of strokes. And be like Shamari, go and lose 45 pounds. He's my Shamari, you're my little unicorn. I'm aiming to be like you because it's very motivational to see that you've been able to do it with a pretty simple modification in lifestyle when you think about it.
So yeah, definitely. And Dr. Romnish is always that doctor that points out certain things, right? So he definitely is one of us, because if I ever came in, he'd be like, man, Shamar, you got fat. So that was good motivation as well. But no, just made the decision that this year was the year. My youngest is now of the age where he doesn't wake me up at that time that sleep is an issue. So I was able to carve out 45 minutes, an hour a day, get on that elliptical, and always ate healthy enough. You'd have your cheat days, but for the most part had healthy eating. So since April, been on that journey. Now at 46 pounds.
Nice.
So
wow, you're gonna get to 50. I know it.
Still have a little bit more to go, but definitely gonna try my best to keep it up.
That's awesome.
And the interesting thing is, every doctor that we bring on from Health City, the risk factors are within 90% kind of the same for all of these different ailments.
Exactly.
So it just shows you the importance of
lifestyle,
healthy lifestyle, obviously a healthy diet, keeping active, as well as you mentioned, knowing your numbers, right? Because even with that lifestyle, there are individuals that still, for whatever reason, family history and such, will be at risk and sometimes have these issues. But if you know your numbers, you give yourself the best probability of being able to catch things earlier and have better outcomes based on it. And even Dr. Romnish was speaking about the interventional radiology component where, interventional neurology component, where you can extract clots and such. And Dr. Romnish if someone has the right type of stroke, and gets to you and you're able to extract those clots, you can reverse the effects and they'll have no deficit or virtually no deficit as well. I think that's important if you can just touch on that so that people can be aware that based on you being an interventional neurologist, depending on the type of stroke, you can actually almost reverse the full effects, or in some cases reverse all negative effects of a stroke.
Absolutely. If the patient reaches us within the window period, within the time period, we extract the clot, everything goes well, the patient can have a complete recovery. In the last couple of months, we've had 2 patients, younger people, about 40, in their 40s, who've had strokes, reached us in time. We've extracted the clots. They've made complete recoveries. One was actually discharged in the next day, the other one after a couple of days. So, yes, if we intervene in time, the outcomes are far better. And
We got a couple comments and questions here. Damien, good morning. Says, I'm still here trying to come to terms. My mom died 3 weeks after having a stroke, which affects her right side and affected her speech due to a blood clot on the brain. She died on August the 21st, 2025. Wow. Damien, we're so incredibly sorry to hear about your loss. Very, very sad. Good morning to Jasmine, joining us from Hartford, Connecticut. Hey, Jasmine, how you doing? And the real Michelle Teresa says, what should we do as a patient if we find ourselves alone awaiting assistance? So is there anything you can do? Like, say you've recognized that you've had a stroke. And, you know, I've got a cousin who actually had one some months back, last year, I think maybe by now. And she didn't, it's so weird, but her brain wasn't recognizing that she had a stroke. And I think she called someone on the phone and they were like, are you okay? Like there was something in her speech that made them think, no, something's not right here. And they said, you need to get to an emergency room. And I think she even drove herself, which is probably not the smartest idea. But they're like, you need to get to an emergency room right now because I feel like you're having a stroke. And it was the way, I can't remember the nuances of it now, but it was the way that she was like responding to them, that they were like, no, something's wrong with you. And so when she went in, you know, sure enough, the doctor looked at her and immediately they're like, oh my God, you're having a stroke. Yeah. So if you're at home by yourself and you recognize the symptoms, and you call 911, between the time that 911 gets there, is there anything else that you could possibly do?
No, because again, unlike with chest pain, some people suggest taking a baby aspirin or a blood thinner. The problem with the stroke is you first have to decide, you first have to know whether it's a ischemic stroke or a hemorrhagic stroke.
To determine the treatment.
To determine the treatment, because if it is hemorrhagic, obviously blood thinner should not be given. So which is why it is most important to call 911, get to hospital as soon as possible.
Yeah. Maybe the only thing you can do is make sure the door is unlocked, because you don't want to call 911. They still can't get in, because sometimes we forget, if you're capable of doing that, but sometimes we forget little things like how people are going to get in their houses or, you know, that sort of thing. We do have another question coming in on WhatsApp. This person says, good morning, Sandy. I know you're discussing strokes, but I do have a question since I experienced most of the symptoms of a stroke, but due to Bell's palsy, if a person has BP for over 1.5 years, can continued stress cause a stroke? Should they do a new scan? Thanks.
No, so Bell's palsy and stroke is 2 completely different things. Bell's palsy is where the facial nerve, which innervates the facial muscles, gets affected, most commonly due to some kind of viral illness. There will be no other symptoms, as in no limb weakness and no eye signs, none of that. It'll just purely be the facial nerve. This is not a risk factor for a stroke, and they're 2 completely different things. So you do not need to do another scan if you've had Bell's palsy.
Right. Okay. All right. So answer that question for you. So folks, Health City is stroke ready, as they are with really all types of acute emergencies. They are ready to manage acute stroke emergencies from diagnosis to advanced intervention and rehabilitation. They have a 24/7 emergency room and imaging services for immediate diagnosis. Interventional neurology team, Dr. Ramnesh is one of the team members there, capable of performing clot retrieval procedures and also specialized stroke protocols to ensure rapid triage and treatment. And of course, this new advancement in technology, Rapid AI, another tool to help them get you to a better outcome faster, and comprehensive rehabilitation services to support recovery and reduce the risk of reoccurrence. Now, what is the reoccurrence chances if you've had one stroke? I'm assuming that probably puts you high risk for subsequent strokes.
Yes. So after a person has had a stroke, we then move on to evaluating what has caused the stroke. Is it high blood pressure? Is it diabetes? Is he having an arrhythmia in his heart causing clots to form? Based on that, we then do secondary prevention. Sometimes they could have a narrowing in the blood vessels supplying the brain. So based on that, secondary prevention is started with blood thinners, which could be like aspirin, clopidogrel. Sometimes we may need anticoagulation. So again, it depends on the cause of the stroke. The patient would then be put on secondary prevention, which reduces the risk significantly. But as you rightly said, there's nothing which can make it zero.
Okay. All right. Well, this has been extremely educational as always. Thank you so very much. Any final thoughts or comments about this?
So everyone needs to remember the acronym Be Fast to recognize the symptoms of a stroke. And as soon as, even if you're suspecting and not sure, it's better to go to the emergency department, let a physician have a look at you and decide whether anything further needs to be done. And time is brain. The earlier the intervention, the better the outcomes.
Fantastic. Shamari?
No, and just want to thank Dr. Ramnesh, my good friend, who always, pokes fun at me for coming on. Just want to say that, next time, maybe we'll make it radio so that people won't have to look at him. But
your treadmill is missing, Shumari, from the background.
Sorry?
Your treadmill. You used to have a treadmill in the background?
Yeah, no.
Oh, that's when he's at home.
I'm in the office to make sure, I won't call the internet provider that I have that I don't quite trust because it keeps dropping even more so recently than otherwise. But eventually I might call their name so they can kind of fix it. But anyway, so I just make sure that I have internet by being here. But yes, the treadmill it's an elliptical, Dr. Ramnesh, and there's no clothes on it. It's being used. But no, it's great to be here with Dr. Ramnesh and just outlining the capabilities that Health City has from a neurology perspective, from a stroke perspective, and we have a ongoing partnership that we've seen transfers from HSA to us to be able in time to be able to have positive outcomes, and we look forward to that collaboration continuing. And if you listen to the Minister of Health in Parliament, she's talking about C instead of C, collaboration versus competition, which makes sense, right? Because
absolutely
there's gaps.
Because patient care is the most important thing.
Correct. And technology that Health City has, as well as other centers, that just figuring out where it makes the most sense for each facility to play in. And we're so happy to have Dr. Ramnesh and the whole team, because we have a whole neurology and neurosurgery team that's able to, for the most part, impact most areas. And as we mentioned, the rehabilitation, yes, you would have to go overseas for that component, but the actual saving of a life and that very important first instance of intervention that needs to happen, we're able to actually provide. So thank you, Dr. Ramnesh. Thank you, Sandy. Look forward to seeing you next week, and hopefully there'll be another Dolphins win.
Some good news,
even though I feel a way about that, because we need to get rid of the coach and GM, but still happy days.
Accountability is coming. So listen, we have been doing a little challenge here. I don't know if you've been watching us with our squatting challenge, and I'm going to invite both of you to join me this morning. So we know that a sedentary lifestyle is deadly to so many aspects of our lives, including strokes, which we were discussing today. So to kind of help myself and motivate and help other people along the way, we are doing a squat challenge. For every hour that we're sitting, we get up and we do squats. So goal 25 to 50 squats. I've been actually doing the holding squat, which is a lot harder actually than the regular squat. So I want everybody to get up, and everybody knows about 8:30ish is when we do it. So just in the nick of time this morning. So we're all going to stand and we're going to wiggle it out. Come on, Shamari, do it with me. I know you've already walked your hour, but come on, Dr. Ramneesh. Yes. Fantastic. And I don't normally adjust my, I can't even adjust that camera. But anyway, we're going to go ahead and try. I've been aiming for 50. So what I might do, first of all, let me check my counter, make sure that we have Miss Vernita. She's in the UK. She's in charge of counting for me, because as I'm talking, I often lose count. So make sure somebody counts for me. So I'm going to do maybe 10 regular, and then I'm going to hold it in place and try to do like a 40 count. Okay, so everybody ready? Evelyn says she is ready. Who else is ready with me? Give me the thumbs up there in the comment section. Obviously, if you're driving, you can do the calf raises if you're in a safe place to do that. So let's get it done. All right, so we're gonna go down for 10, and then I'm gonna hold it for a count of 40, but if you wanna keep doing the regular ones, go right ahead. Okay, everybody ready? Let's do it. All right, there's 1, 2, 3, 4, 5. This is when I'm like, speed up the count. 6, 7, 8. Yes, Barbara G, get moving. 9, 10. Now you guys can keep going. I'm going to squat and hold it. 11, 12, 13, 14. Oh, these are hard. 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, let's do 30, 26, 27, 28, 29, 30. Oh my gosh, you feel the burn?
Yep.
Feel the burn.
Oh, wow. Something as simple as that. Even if you can only do 10, get up every hour at your desk, because think about it. You work 8 hours a day. If you're sitting most of the day, it's wreaking havoc on your life. So, whew, I can feel the heart thumpity thump. So that's your challenge. Thank you both very, very much for being good sports. Evelyn, how many are you doing today? She says, wow. Shamika, send me your numbers. Let's keep each other accountable. So we're starting with squats. Shamari, we'll be there soon enough. Before you know it, 50 pounds later, I'll be able to join the 50 plus club in a good way. Barbara did 40. Congratulations, Barbara. Miss Denise, she says she's out of breath and she did 30. Awesome. Very good. All right. So remind me, 9:30, we're going to do another set. Shamari, Evelyn did her 30. Congrats. Thank you, Dr. Ramneesh. Thank you, Shamari. Appreciate it.
Thank you.
All right. So you hear me out of breath a little bit there. Yeah, that's what it's good for the cardiovascular. That's right. We just did a little movement, and that's what it's all about. All right. Good stuff. I feel good. You do feel good though. The heart rate is going to come down here in a second. And I do watch my heart rate. I told you guys I have my little Aura ring on. So now I'm able to, it says it's updating. I'm able to get my heart rate and my beats per minute in real time. My goodness, sorry. So it said 16 minutes ago, my apologies, I was, my psychological stress levels are quite low and your body is relaxed. Very nice. How can you foster healthy balance? And then my resilience, it says solid with no major changes. Move when it feels good. Readiness, it tells you haven't been active recently. So this is all the good stuff. Now I got to improve on that sleep a little bit. I am working on it. But meanwhile, yeah, we just got a little bit of movement in. So we're going to keep at it, keeping as active as possible. Vitals. Let me go to the vitals. Yes. Activity goal. That's where we have to increase. And of course, my heart rate now went up. And then we're going to see, because it's important how quickly that comes down as well. Okay, so we're monitoring all of those good numbers. Thank you so much to Health City. We're going to go ahead now. And oh my gosh, Shamika, you did 55. Oh, girl, that's good. I did 50 over the weekend, like a couple times, but some days, I can only hold it. You're still going. Good for you. I love it. Demara says, wow, my knee, it gets better. Let me tell you, having those glutes stronger will actually help your knee. So just stick with it. You know, you might not be able to do 25 or 30. Start off with 10. And then we've got some other knee strengthening exercises we're going to incorporate. And you know who we need to have back on the show? We need to bring back Miss Carla on the show so she can show us what she has been up to in terms of health. She had a client that dropped, oh my gosh, I forgot how much weight, like some ridiculous amount of weight. Just again, doing all the really good things, the diet and the exercise. So, you know, these programs are coming to CMR TV. We're in the last and final stages here of getting everything together, and the content creators have been working extremely hard as well to ensure that, I'm just trying to find this video to share with you guys, to ensure that they are bringing you amazing content. But I'm super excited that every single show I'm excited about, like in a different way, because the content is just so amazing. But I do find that there's some that I'm like, oh my God, I can't wait for this. I can't wait for that. Because yeah, they're all going to be amazing. So if I find the one with Carla, I will play that. I know we had it last week. Where did we save it? All right, I'll pull it up at some point so you guys can see the amazing work that she's actually doing with clients, because it makes a world of difference when you can actually see the amazing work that is, you know, that people put into this. It's not easy, that's for sure. Or here we are. I've got the video now. Have a look at this. This is so cool.
People ask me why. Truth is, it is never too late. Strength isn't just in muscles. It is in your courage, in confidence, in believing you're worth it. Every stretch, every step, every smile reminds me that beauty doesn't expire. I'm just getting started.
I love it. Just getting started, honey. Yeah. Wonderful. All right. Thank you so much, Carla. Keep going, because we are going to be right behind you. Let's talk about Hurricane Melissa. OMG. I'm trying to get the latest notes here and update on where we are. Of course, Jamaica last night into the early mornings, actually, early morning hours. Yes. You know, this storm hit Jamaica and may very well still be over Jamaica, right? So let's try to get some updates on where things are this morning. And then what we can do is, oh, I noticed Microsoft Office updated on my computer. What we can do is, let me just grab some notes here. We can see what the latest is. And of course, we're going to call some people in Jamaica to see how they are doing as of this morning. So just give me 1 second here as I am. Right. As I get some of the latest details. Okay, so let's make some phone calls first and foremost. Unfortunately, as of last night, sad to report that there was already some loss of life, which I was shocked at, but in zinc and stuff on the roof. Oh my gosh, I couldn't believe it. And there were, believe it or not, people out there partying. And I'm like, what? Yeah. Ooh, honey child. Jamaicans believe in living their life on a next level. They're like, well, if it's going to go, I might as well just party it in. And unfortunately, to report, there was also crime. So there was a double murder last night. I'm like, who the hell has time to be murdering people when a critical hurricane, a Cat 5, hurricane is coming? Now, let's talk about the historic nature of this storm, first of all. So last night, you might have noticed that quite late, we were still posting things in relation to the storm, including the fact that, this storm was going to potentially be the worst storm in the Atlantic Basin in history. They were actually comparing it to the 1935 Labor Day hurricane in terms of the pressure, because apparently the pressure dictates how bad the storm is actually going to be. And they saw the pressure drop from 909 millibars. And they were saying that if this continues to go in this direction, it was going to drop below 900, which is a very dangerous position. And there's only like one other storm that has done that. And that is in 1935 with this Labor Day hurricane. And that is the strongest hurricane ever to make landfall in the Atlantic Basin. So here, Hurricane Melissa challenging the 1935 song didn't even have a name. I'm guessing back then they probably didn't really name them. So challenging, a storm that is how old? I mean, oh my gosh. I've never actually heard about this 1935 Labor Day storm, but apparently it hit the southeastern US in early September and was a devastating storm. For several decades, it was the most intense Atlantic hurricane on record in terms of the barometric pressure, which that's what we keep talking about, right? And the 1 minute sustained winds for the storm, as well as the strongest at landfall at 1 minute sustained winds being, let me see what the landfall was with this one. But yeah, so this storm was, the mother of all storms back then. And the 1935 Atlantic hurricane season, this was the second major storm of that season and one of four that was on record for striking the United States, along with Camille, Hurricane Andrew, and Hurricane Michael. And so the hurricane intensified rapidly, passing Long Key on Labor Day evening of September the 2nd, and the region was swept by a massive storm surge as the eye passed over the area. So this is Florida, of course. So caused catastrophic damage in the upper Florida Keys as a storm surge of approximately 18 to 20 feet swept over the lower lying islands. So I must tell you, I didn't know much about the 1935 storm, but Michelle was hell-bent on challenging that storm and the devastation there. So we know that from that perspective, the storm was competitive, and competitive not in a good way. We were looking at winds gusting. They had Melissa had sustained winds of 175 miles per hour as a Category 5, but then gusts were upwards of like 246 miles per hour. What? This is so crazy. The hurricane hunters had to abort their mission into the storm earlier yesterday due to extreme turbulence, highlighting the peril of the core. And the hurricane was projected to go over western Jamaica, which would be Hanover, Westmoreland, St. James, and St. Elizabeth, and they were going to get the brunt of its fury. So we're going to check in now to see how people have done. But undoubtedly, we know for a fact that there would be additional costs, loss of life, which is just so incredibly sad. But let's go ahead and, yeah, somebody said, did you hear what most of them say? They can't leave their homes because of thieves coming to steal their belongings. It's just so sad. But let's see if we can get some, let me just see here. We're going to contact some of our journalist colleagues. And then we're going to just contact regular citizens to see, this is a 1935 storm. This is not the 1932 storm that hit Cayman Brac. Totally different storm. And back then, it seems like they didn't have the naming system yet, so they just went by the year. So that was the Labor Day 1935 storm. All right, so let's go ahead and get some updates so that we can figure out, what the latest is. We spoke to some of these residents yesterday, and we'll give them a call back to see how they have fared so far. So, yeah. Okay, let's see. Okay. Oh, okay. No answers from that one. All right, we'll try another one. Let's see here. Yes, and like we said yesterday, some communities we know would be cut off from support maybe for at least a couple days. So let us see if we can reach anybody. In the meantime.
Hey, Sandra, what's up, morning?
Hello, good morning. How are you?
Hi, Sandra.
Hey, morning, can you hear me? Yeah, hello?
Hello.
Hi. Hold on. Let me make sure.
Hello.
Oops, hold on. Hey, good morning. Hold on one second. There we go. Can you hear me now?
Yeah, man, I hear you now.
Okay, good. Just checking in with you to see how things are going there in Kingston.
Well, we had some really strong winds last night. So some trees and stuff blew down last night. The rain has stopped. Well, hasn't stopped. It just hold up for a time and then it start drizzling again.
Yes. What are you hearing about the side of the island that would have taken the brunt of the storm?
So I just spoke to a friend of mine. He's from St. Elizabeth, and he's saying it's raining and the wind is very heavy down that side.
Okay.
So he's feeling it right now. Down that side is getting the blunt of it right now.
They're still getting it pretty strong.
Right.
All right.
Yeah.
Wow.
I'm here looking on the harbor, and you can't even see the direction of the wind. You can see the direction the wind is blowing just by the waves, the way the waves moving now. Sea is very choppy. I've never seen the harbor so rough like this. It's rough.
Wow. Are you hearing anything about loss of life? I mean, we know that there were 3 people, unfortunately, that had died before the storm that are going to be counted towards the storm deaths. But are you hearing anything else?
Just those 3. I've been hearing about no more yet.
Okay.
I hope no more. We just need to stay inside and wait this thing out.
Yeah.
It's going to be moving very slow across the island.
Mm-hmm. And what are you hearing? I mean, we were hearing up to yesterday, late last night, that there were some people out having hurricane parties and all kind of bashment stuff going on. I mean, that sounds a little crazy.
It was just this morning we were talking about that. Jamaican people, man. You know, I think it's a way. Of dispelling the whole, you know, animosity surrounding this storm. Is, you know, that's their way of expressing fear.
Mm.
Dance and laugh about it. Jamaican will laugh about everything.
Yeah, you know? Yeah. So no matter what, Jamaicans are gonna have a good time with it.
A Jamaican will see a bucket too, you know, and you're in pain, and him laugh after you. You know, that's how Jamaicans are. We make fun of everything.
Oh my God, what a mess!
Friend of mine said, "Boy, in this world, you have to see a wood sip on a banana skin, and we laugh." So that's it. That's the concept.
That's the concept. Oh my goodness. All right. Yeah, well, thank you for the update. You haven't been home since the storm, or you've actually checked on your place?
So I pop in every now and then when I can. Like, I'm gonna pop in right now.
Yeah. Because you've basically been working the overnight shift.
Right. Basically, we've been here from the whole announcement of the stuff.
Yeah.
The storm.
So one of the areas that we were keenly watching was Flatbridge. And I know now that Flatbridge is actually, it's talking about flat, it gone. There's no Flatbridge. I mean, I see nothing left.
Yeah, man. Like I was telling you yesterday, that area, there's no road. It's just pure water.
Mm-hmm.
It's a gorge, you know. Mm-hmm. So all the water of the hillside, all the water from the Lindsay town, the rivers, everything dumped right there. So it's gonna be flooded.
Mm-hmm.
And that narrow V-shaped gorge.
Yeah. So people might remember there was a little bridge here yesterday on top of boulders. As you can see, this just looks like a river running through that now.
Man. That's how it looks. Even not no hurricane, just heavy rainfalls.
It's gonna happen.
It's gonna happen. So
wow.
And I'm sure the gates are closed.
Mm-hmm. Yeah. They closed it yesterday ahead of the storm. All right. Well, thank you so much. We're trying to just call a few people and see how you guys are doing.
Hello?
No, I was saying thank you so much. We were just touching bases with a few people to see how everyone's doing.
Yeah, man. No problem.
All right, my dear. Thanks again.
All right. Cool.
All right, folks. So yeah, there's Flatbridge. Flat now for sure. Flat River is what they have to call it. So yes, eat, drink, and be merry. You may be dead tomorrow. That's the old saying, says Barbara. Well, Jamaicans take that to the next level. Storm Wilt says the younger Jamaican, my grandmother would say, young birds don't know storm. A child, they're not even, yes, that's Flatbridge, George. You're asking where's the bridge? Underwater right now. So yeah, here's a song, by the way, that was created yesterday. We put this on social media again to the testament of Jamaicans being resilient and happy. And they're like, whew, we're in the middle of a hurricane. We can still have a little party, a little bashment, a little music.
Guys ain't here.
Yes, little vibes.
But this is not a Kaiso. This is a one-drop message. A special report for our family in Jamaica. Melissa is at the door and she planned to overstay. Lord of mercy, batten down Jamaica. The whole Caribbean family, we standing with you. Hear the rhythm. The sky get dark over Kingston town. Hurricane Melissa, she's slowing down. They say she go over for 5 long days. That is a heavy, heavy price to pay. The shelters are open, the country on alert. We praying to Jah that nobody get hurt. Batten down the a prayer. In this time, you know we care. Jah guide and protect ya. From mountain to coast, is the strength of the people we love the most. Remember the Bahamas, the pain they feel when Hurricane Dorian just wouldn't leave. That storm that overstayed 2019.
All right, little vibes there. We'll play some more of that here in a little bit, but we're going to do some checking in now on a number of different fronts. So let me just unmute this one.
Robert Ray, who starts us off tonight in St. Anne's.
So this was last night.
And Robert, I think a lot of people woke up, they saw you, and they were saying, wait, I thought he was on the other side of the island. Can you walk us through what your day has been like and the people you have met so far in Jamaica?
Yeah, hey, Steve, good evening to you from St. Anne's Bay here on the north side, basically the center of the island. And by the way, we just lost power, and we don't even have heavy winds. We heard a transformer blow, and this is what we're dealing with. It just depends on where some of those wind gusts are, and we have not even really begun. Well, in fact, we haven't begun at all the true impacts of this. So we are being lit here on the beach, the Atlantic behind me. I won't be able to stand here at all tomorrow. Yeah, we started off today in Kingston. Take a look at the video of the mountains surrounding Kingston and just sort of the murky feel up there. Some outer fringe bands were making their way through, and also people boarding up restaurants, businesses, anything they can to prepare for the onslaught of this historic hurricane. But Steve, we decided to move. The power just went back on. This is what we're going through, and this will be the ebb and flow, by the way. Our decision to move was twofold. First of all, we were not going to head to the southwest part of the island. That is out of the question. 170 mile an hour potential winds, Cat 5 landfall, unsurvivable. This team is not going to put ourselves in a situation like that. But we did come up the center of the island about 60 miles to here to St. Anne's Bay because as this hurricane treks across the island, makes that northeast cut, we are going to likely be in anywhere between Cat 3 and maybe even Cat 4 winds. We'll be in a 4 to 5 structure. I'm going to bring in Jared Maloney here.
So let me just say this, folks, to be clear, one of our members here at CMR just sent me this for 9 o'clock this morning. This storm is nowhere near being done. So this is Hurricane Melissa tropical cyclone update as of 9 a.m. Tuesday, October the 28th. Air Force Reserve Hurricane hunters find Melissa stronger as the northern eye wall is approaching the southern coast of Jamaica. And that's the 9 a.m. position update. So I'm like, wait a minute, the eye wall not reached yet? No. The eye of Melissa is nearing the southern coast of Jamaica and is expected to make landfall within the next few hours. Let me say this. This is what the report says. This is an extremely dangerous and life-threatening situation. Take action now to protect your life. This is the official report. Residents in Jamaica should not leave their shelter as winds will rapidly increase within the eye wall of Melissa and remain in place throughout the passage of these life-threatening conditions. Air Force Reserve Hurricane Hunter aircraft has found that Melissa is strengthening, Lord Jesus, with maximum sustained winds of 180 miles per hour. That's 290 kilometers an hour. Estimated minimum central pressure based on aircraft data has fallen to 896 millibars. So there you have it, folks. It has fallen below the 900, which is what they were saying would make this compete with the 1935 storm. Sorry. Wow. Unbelievable. So still much more to come. It has picked up speed. Thank you so much. Northeast at 7 miles per hour. Now, the most amazing thing about this storm is the fact that the eye, I was looking at this yesterday and there were some pictures of this. Let me see if I can just find this again. And this meteorologist was saying that he has never seen the actual eye of the storm what they call the what do they call it? Oh my gosh, let me see if I can show you this video. Fox News had a really good video of it, but he was talking about that sort of formation. Like the eye is amazing, apparently, to go into, except you might not come out of it. That's why that hurricane plane was having such a hard time. But he'd never seen an eye quite like that. Like he was like, this is, it's amazing to watch, but it's so dangerous. There's like video footage of lightning flashing in the eye of the hurricane as well. It has just been like record breaking, but we have the technology to watch and see so much of this now that it makes for a very interesting time to be alive. I mean, it's like, wow, how are these things even possible? The other thing that was so bizarre is apparently there were a bunch of birds actually caught in the eye wall. So somehow, they were in the eye wall and they can't get out because the winds are too powerful. So they're trying to fly out and they cannot fly out of the eye wall. Can you imagine? Of course, poor things are probably going to perish, right? I don't see how you not, because if you can't get out, you can't get out. Let me just see if I can find this picture, because this picture was like, OMG. Got some video footage of the eye wall as well, but it was just really, really something else to be able to watch and to see this. Let me just see if I can trying to grab it for you. And, not for nothing, but some crazy things going on with, oh yes, here's the picture. Look at this. This is just like, when you see certain things and you're just in awe of Mother Nature. Let me show you this photo. So this is only way we're ever going to see an eye wall. This is what the eye of Category 5 Hurricane Melissa looks like. It's called the stadium effect. So pronounced and well defined. And this meteorologist says that this is going to be in meteorology textbooks. My heart breaks for Jamaica. So the fact that the eye wall was just so perfect as eye wall goes is actually not a good thing for the storm. That means that it's extremely devastating and powerful. So here's a couple additional. This is the actual plane. There's where they got that picture from. This is the Hurricane Hunter's plane that went into the eye wall. So look at this. Isn't that amazing? And yes, they had to abort part of their mission. The plane just could not sustain it. They were probably going to crash, to be honest. So they had to come out. Here's another satellite image, lightning flashing within the powerful eye wall of the hurricane. Let's look at that again. Isn't that amazing? It almost looks like a science experiment. Look at the lightning. Isn't that something? Like it's sparking just like that. Electricity. Oh my gosh. Very, very interesting. So yeah, that's what's going on there. It's just absolutely fascinating. Fascinating to see, fascinating to watch, but I'm sure not really fascinating to be in, that's for sure. All right, let's make a few more phone calls and see if we can touch bases with people. Obviously, lots of rain, lots of flooding. Okay. And we are trying to okay. 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 All right, so let me just see here. Let's see. Right, so we're going to make another phone call this morning and get a further update. Hello, good morning. Good morning. Can you hear us? Hello? Uh-oh. Hello? Connection issues. Hello, good morning. Nope. Hello. Okay. I don't know. We're trying to call, but of course we can expect probably some nope. Okay. Try one more time. Connection problems. So power being out, I'm sure. Hello, good morning. Hello? Hello? All right, no luck there. So yeah. Okay. I don't know. All right, trying to see who else. All right, so thank you. Abby says Melissa is heading northeast, not coming to Cayman. Please don't spread misinformation. Who said it was coming to Cayman? Nope, she's holding her position. Yeah, Jazara, this storm is pretty wild. Let me just see what else we have here in terms of updates. Let me just see here. So, right. So 85 gusts, now sustained winds of 185 miles per hour. So it has strengthened even more. Western Jamaica, Western and Southern Jamaica getting the worst of it, affecting parishes such as Westmoreland, St. Elizabeth, Manchester, Hanover, St. James, Trelawney, St. Anne, and Clarendon. Considered the strongest hurricane Jamaica's ever experienced and among the most powerful landfalls in the Atlantic basin. So that's where we are. And at the end of the day, if she continues to strengthen, she might take over the #1 spot. So residents in affected parishes, again, being urged to protect themselves and their families in the most interior parts of their homes, ideally the bathrooms, with mattresses, blankets, towels, as the risk of roof and wall failure extremely high. Authorities advise having shoes on and using buckets or pots to shield heads in the event of structural collapse. Hadn't really thought of that. That's a good idea. Have a bucket close by. Yeah, not a bad idea. I got to get me some buckets. The eye of the hurricane offered a brief 10 to 30 minute period of calm, after which winds would violently reverse direction. So that is why they're saying that don't think that the eye, once you see that calm, you think it's over. Don't go running outside. So the storm path and timeline for today, early afternoon, 2 to 3 p.m., the eye is going to be moving north through Jamaica, heavy damage along the northern coast near Montego Bay, Falmouth, and St. Anne. By 5 p.m., the storm lifts towards southeast Cuba and southern Bahamas with weakening but still significant impact. And over the next following days, we are looking at southern Long Island and Crooked Island in the Bahamas, expected to receive sustained hurricane force winds of between 9 to 100 miles per hour. Bermuda and Atlantic Canada to see rain and gusts as the system transitions out of the tropics. So there will be lots of, community efforts underway. The government has already released a statement here, our government that is, that they stand prepared and ready to assist Jamaica in any possible way. Naturally, these are times that we have to be our neighbor's keeper. And, I know some people are like, well, nobody ever helps us, Sandy. Where are you helping us? And I understand the sentiment up to a particular point, but we can't be like everybody else. We have got to ensure that, that we are better and we help because we can help. We don't find excuses at a time like this and complain that nobody ever helped us. All right. So we help our neighbors. And, someone said even yesterday, they felt like some comments that were being made, they weren't appreciating that we had gone through this. Well, listen, I understand. They don't know what we went through over 20 years with Ivan. People tend to forget. We're not forgetting because that was our struggle. And we obviously remember it like it was yesterday if you went through it. So here's a statement from Her Excellency, the Governor, and the Honorable Premier, Andre Ebanks.
We come to you today with a united message about our government's commitment to supporting our regional neighbors in their time of need. Hurricane Melissa has rapidly intensified into a Category 5 hurricane. We anticipate many of the challenges Jamaica now faces, and our thoughts and prayers are with them.
Hazard Management Cayman Islands is working closely with our regional partners and relief organisations to establish an effective assistance framework. We're monitoring the situation around the clock and will respond swiftly if and when Jamaica requests support. Our commitment is simple: to stand with the people of Jamaica and bring help that truly makes a difference.
We call upon our Caymanians, residents, and business partners to stand ready to support relief efforts. We will provide clear guidance through official government channels on what, how, and when you can contribute most effectively.
As Caribbean nations, we share common challenges and a common responsibility to support one another. The Cayman Islands will continue to be a reliable partner, both to Jamaica and to our wider region.
To our neighbors in Jamaica, know that we are monitoring the hurricane closely, and we are ready to provide aid and assistance to you. You are not alone.
And to our community, please continue to monitor official government channels for verified updates on how you can support the relief efforts.
All right, folks. So one thing I do want to say in relation to the relief efforts is I've seen people sending around voice notes and stuff yesterday saying that they're going to be starting their own relief efforts, and they have, gotten confirmation from certain shipping companies that they're going to be helping. Listen, leave it to the experts. The government will be directly assisting, no doubt, with hazard management and their team of professionals. Red Cross will undoubtedly be spearheading, probably in conjunction with the government, some relief efforts as well. I would really say to you that ultimately, those are the best bets in terms of how to get things, the assistance, the actual assistance that's needed properly to the persons that require it. This sort of mixing hodgepodge of like, we'll try to get things, we'll just donate our things that we don't want. That's not necessarily what the people need. The people will need certain things, and the respective agencies, they are in the best position to assist and know how to coordinate the relief efforts. Okay. So that is why I want to say it's, I guess, and, congrats on trying to help, but you may not be helping as much as you think. We've seen the Red Cross in the past do interviews and say, listen, most of this stuff that you all are sending is going to end up in a landfill. It's going to end up in a dump. It's going to, make their situation even worse because it's not what they need right now. They don't need your clothing. They don't need, your shoes that you no longer want and all this kind of stuff. They might need medicine. They're going to have excessive rain following this storm, which would mean increases in dengue fever. There's very, very specific things that they're going to need. And so those individuals who are those NPOs and agencies who are coordinating the efforts, they're in the best position to do so. There's also a good degree of accountability, right? So I can't, the lady in Prospect who wants to put together, a container or two and send it through her friend who owns a shipping company, I can't swear for the accountability involved in that, of where the goods are going to go, how they're going to get there, once they get there, how they're distributed, because she's not going to Jamaica to ensure proper distribution of the funds on the ground or any of that. So don't just jump up and send off a container just to go somewhere, right? That's not going to be helpful. There has to be a concerted effort of exactly how the donations are going to be received, how they're going to be distributed, et cetera, et cetera. Good morning, caller.
Morning. Just a thought, perhaps. I'm sure they're already thinking of it as well, but perhaps Kim and Airways could do like a cargo flight, because I know, like, for instance, if you have a family member or a friend in Jamaica and they've already messaged you and said, okay, well, this is what I need, I need Pampers or whatever, right? And you want to make sure you get a specific package to a specific person, perhaps, Kim and Airways could arrange a flight or two with that sort of thing to allow people to send things directly to certain people.
Yeah.
I mean, I don't know if that's an option, but
yeah, I'm sure the government, that's what the government would do. I mean, obviously the government owns Kim and Airways. So I'm sure they're going to organize efforts in an official capacity like they have in the past, right? So
and I agree with you 100%. Like, we can't just be doing things willy-nilly and just like sending whatever, like you said, things that they won't even need, Thank you.
Yeah, not a problem at all. Thank you very, very much. So yeah, I mean, ultimately, we want to ensure that the people who need it are the people who are actually getting the help and getting the right type of help that they actually need as well. So stay tuned, I guess, to official government resources in terms of that. So some people sending us some footage here. I'm a little bit weary of sharing footage because I know that in the past, unless you can verify who the footage is from, some of it, they're taking like old storms and repurposing it and claiming that it's Hurricane Melissa when it isn't. But at this point, this could very well be Melissa. So let me just put a little bit of a caveat out there with this, but here we go. Someone sent this footage in of just the rain and the rivers and the gullies overflowing. People playing in the water in the streets. Lord have mercy. Sliding in the water. I see it. All right, folks, it would still be in their best interest to stay inside, though, because this storm is nowhere near over. So get back inside. Good morning, caller. Welcome to the program.
Good morning, Miss Sandra.
Good morning, dear.
I came off the flight last night and someone mistakenly take up my son's suitcase with his clothes. I just buy some new clothes for him. So I'm just calling no name was on the suitcase. I'm just calling to ask the person, please, to return it back.
Which flight are you talking about? Which flight were you on?
Panama. It was Panama.
You were coming in from Panama. Okay.
Yeah.
All right. So if anyone accidentally picked up a suitcase, give us a description of what the suitcase looks like.
It's a black pulley.
A black pulley.
Carry on.
Okay. All right. So someone has...
And it's having some children clothes, a whole cushion for a sheet set, and 2 new pair of shoes and some new pair of children clothes. He's 11, so he's kind of big.
Okay. Yes. Okay. Well, thank you so much. Really, really appreciate it. Yeah.
Thank you, Miss Sandra.
All right. Thank you. So if someone
You can
has,
call.
just
Sorry.
WhatsApp me. Don't put your number out in the air. Just WhatsApp me your number.
All right.
Okay,
sorry.
there. So someone accidentally picked up a black pulley last night. Coming back from the Panama flight, please double check if it's not yours. Some people really wait a long time before they check, their suitcase and unpack. So just double check and make sure that you've not accidentally picked up somebody else's suitcase. That's why I don't really buy black suitcases anymore, because everybody has a black suitcase, everybody has a black pulley, and unfortunately, they all look alike, quite frankly. So I get like really weird and odd colors and make sure that all of my pieces have my name tags on them. Good morning, caller.
Good morning. I'm sorry, I had to call back about the suitcase thing, right? If you know that you have a suitcase that looks like other people's, just look at the white tag. The tag that Kim and Aries puts on the bag has the name on it. So just check your tag. It takes you 2 seconds before you leave the airport to make sure you have the right bag. If you know that your suitcase is not unique and you don't have a tag on it, just check the white tag that Kim and Aries puts on there, or whatever airline. It has your name on it.
Yeah, unfortunately, most people, you'd be surprised. You would really, really be surprised what people do.
Perhaps they don't know that has your name on it. Well, now they know. That white tag, the white key thing that they put on your bag,
that the
has your
airline
name
puts
on
on.
it.
Right. Yeah, it does. But most people do not go to that degree of, they're not gonna read it. But yeah. It would be helpful if they did, because now this woman would not be looking for her suitcase with her son's clothing in it. So, folks, if you accidentally picked up a suitcase, and it happens, feel free to reach out. Okay. So give me 1 second here. I've got someone who's going to be joining us from Jamaica on the live stream. So let me just send them the link really quickly so that they can join. Yes, honey child. What a mess. Yes, hot tamale. Okay, let me just message her. She's a reporter, part of Jamaican media. I actually saw she presented a question yesterday at the press briefing. It's so good when we are, we're colleagues in the space and you see other people doing their thing. Okay, maybe try calling straight. I heard that video is old footage. I mean, this is a thing. I don't know. I have no way of verifying now whether it's old footage or new footage or whatever. So someone says if you're calling a flow line, you won't get through. Only Digicel is working at the moment. Oh, okay. And thank you for this. This is a good reminder about unsolicited goods. And this is exactly what people are starting to do here. So thank you for this person who sent this through. The Red Cross has a policy about this. I know that they've definitely discussed it before. We've interviewed them before. And they say that unsolicited goods are the second disaster after the storm. So after disaster strikes, everyone wants to help. But what if your donation was doing more harm than good? And so this goes to the fact that you're, trying to do the right thing, your humanitarian efforts, but in fact, these goods end up in the landfill. They don't end up going to people. So this is why, again, let the coordinated NPOs deal with it. An estimated 60% of unsolicited goods donated after disaster cannot be used. And they give some examples here. The 1998 Hurricane Mitch devastates Honduras. Victims on the ground are desperate for medical supplies. An airplane full of medical supplies is making its way to the tarmac, but cannot land because the tarmac is full of clothing and other items that no one asked for. It has to be diverted elsewhere. So this is now, they're showing you pictures of where this has happened. And it ended up upending everyone's plans, by about 48 hours, which is critical time in a disaster. So this is Juanita Reiling, who's the former director of the U.S. Aid Center for International Disaster Information. 2004 in India, the Indian Ocean tsunami, unsolicited clothing donations piled on a beach, and they have a picture there. Wow, it's a lot of stuff. Piled on a beach in Indonesia, quickly went toxic because disaster workers do not have the time or resources to sort through and clean old clothing. Local officials disposed of it by pouring gasoline and setting it on fire. The remains went out to sea. Can you imagine? 2010, Haiti earthquake, unsolicited piles of donated clothes, food, bottled water, and personal grooming items had to be moved aside in order to make room to stage and deliver critical relief supplies. So folks, do not send unsolicited goods. Don't donate to these people who are asking you to do so, because you're only going to make the situations worse, right? Organizations like Red Cross, they will coordinate with the governments in Jamaica, the NPOs on the ground. They'll coordinate with Red Cross, et cetera, et cetera. That is what needs to happen, okay? Because that coordination means that, you know what? We don't need these supplies right now. What we need is medicine. What we need is dengue fever, preventative things, this, that, the next thing. So if you're minded to help, contact the Red Cross, contact whoever's going to be spearheading this effort. We'll know here shortly, I'm sure, in the Cayman Islands government, and see how best you can work with them. This is not time for anybody to be looking a little bit of attention for themselves or glory or whatever the case may be. Okay? All right. Yeah, okay. We're going to see if we can get our colleague on here in a second. And all right, let's try to make one final phone call, but as suspected, the phone lines being down, we're probably going to have some difficulties getting through. All right.
Good morning.
Hi, good morning.
We've been having unstable internet.
Yes, I can imagine.
So while we're on, let's do it fast. Because it's heavy wind outside at the moment.
Yes. And just remind us where you are. You're in the Stony Hills area.
We're in the Stony Hills, St. Andrew area.
Yes.
So we're in the hills, and you can see the trees swaying actually. And just moving, the large trees just moving back and forth. At some point it takes it to the west, then it comes back and takes it to the other side, and that's pretty bad for the trees, because if you keep going back and forth, it will uproot them. So that is what it is at the moment. Whenever it's windy, the rain will stop. Whenever the wind abates, then we'll get some light showers.
Okay.
But for the most part now, we're just some very, light showers. But the wind is very intense now. It's getting very intense. So I guess the storm is now on land, and we are moving into the will not come this side mostly. It will be in the St. Elizabeth side.
Right.
I've heard of houses losing their roofs there already in Mandeville.
Oh wow.
So I spoke with a colleague there, and he said that he has seen houses there with their roofs gone. So things are happening, and we really, going to have to pray and hope for the best for this one.
Okay.
Because while others are not feeling it as much, there are others who are really being devastated because, you know, you can just imagine from now your roof gone.
Yes.
We have not even gotten the full extent of the storm yet.
Yes.
So one man got electrocuted. I don't know why. Because the electricity line get entangled with cord, and I don't understand why he got electrocuted.
Wow.
Some people are just careless, you know. So I guess that's why most of the power has been turned off. They were turning.
Well, it's probably dangerous to
but
leave it
because they
on,
were
but
trying not to turn them off.
Yeah.
They were trying not to turn them off, but some areas they do have to.
You're right.
You know, so
okay.
Fortunately for us, we have solar, but then we are saving some of that power for when it's absolutely necessary. Because we are not going to be getting any charge right now. So we have that's one of the measures that we did.
Okay.
We charge full. So we charge full, turn it off, and was using the local power.
Right.
And saving back the batteries for when we need it when the hurricane is off and they
the
are
most.
not on yet.
Yes.
And
All
we
right.
would
Well,
need it
thank you.
most.
Thank you
Right.
so much. We know there's a press conference that is going to be starting momentarily, and we do have another journalist joining us as well. But thank you so much for the update, and we'll touch bases with you a little bit later on.
You're welcome. Thank
Okay,
you.
dear.
Too. Bye.
Thanks. Bye-bye. All right. We have Zara Burton, who's joining us. Good morning, Zara. How are you?
Good morning. Good morning, everybody in Cayman. Good morning, everybody listening from abroad.
Is this your first time on my show? I kind of feel like it is.
I think so.
Oh my gosh. Welcome.
I think so.
Oh my gosh. We've known each other for years, girl. We've been in the in the journalistic
world. Yep.
World together. Well, thank you so much for joining us. I'm sad it took a hurricane to finally get you in the show. But here we are, Melissa. Wow. She is something else.
Yeah,
Tell us what's going on there. Where exactly are you, Zara? Are you in Kingston?
Okay, yes. I am hunkered down here with the emergency personnel, some local media journalists as well. I decided to come here because I said, okay, if I lose internet at home, I need to be able to communicate with the world still. And they have Starlink here. So I said to myself, well, let me at least go there so that I can have maintenance of internet. And so this is where I am, and it's very humble accommodations, but useful, very useful in this time. So I'm grateful. And I am about to go to the press conference out of this same building. This is where it occurs. And so I can't stay too long, but I just really wanted to give you a sense of where we are, because I think from what you said, you wanted just an update, you know?
Yes.
And we heard from the meteorological service here in Jamaica this morning, 8 a.m., that the hurricane has strengthened, believe it or not. And it is going to make landfall St. Elizabeth / Westmoreland. And St. Elizabeth just got hit by Beryl, and a lot of roofs went. It was a lot of devastation, and that was not a direct hit. That was a skirting of that area. And so you ask yourself, okay, skirting versus no direct hit, what's going to happen? We're not just maybe going to have roofs. We're going to maybe have devastation of full buildings. That's a possibility. And I say that because I remember listening to some voice note or interview with the person who used to head up the same facility that I am now reporting to you from. She was saying at this level of wind speed, right? And she said 175 miles an hour. We are looking, usually you see buildings, you know, compromised. And we know in Jamaica, we have a lot of board house, zinc house, you know, I mean, yes, you have your concrete, but she was saying even that could be affected. And over in the Bahamas, when they had Dorian, which also hit at a category 5, if you recall, there was just flattened structures in some instances. And people had to flee to go to other areas to find shelter. And some of them got injured in the process, ended up at the clinic. I was speaking to one nurse who explained to me how that went down. So you think about injuries. You're thinking about even right now deaths because of the amount of rainfall we're also expecting. Incidentally, even though you have a lot of wind, the people I was speaking to this morning didn't say yet that they're experiencing a lot of rain. I saw 1 or 2 people posting about rain. Like, for instance, somebody in St. Anne sent me a message on WhatsApp saying that they are having some heavy rain. But I know in Kingston here, I'm looking out the window, it's not heavy rain. And it's not heavy wind here. But I know other areas, for instance, St. Elizabeth, where I have connections, they said heavy wind. There was also heavy wind in the grill from one teller that I spoke with earlier. So you do have these areas where they are reporting significant wind. And I wonder if the hurricane is not fully here yet. We're expecting it just a few hours from now. What's it going to look like?
Wow. Yes. Oh my gosh. We do have the Jamaican press conference that has started, so we're going to pull that in.
Has not yet made landfall. The center is still some distance away from the coastline, just about 70 to 75 kilometers from the southwestern coastline, and it is still moving toward the northeast. So it is moving closer and closer to the coastline of Jamaica. I mentioned that it has been moving slowly, but it has been moving a little bit faster than it was previously because it's now moving at 11 kilometers per hour. That's just about 7 miles per hour. And it is expected to make that turn to be more in a direction, moving in a direction toward the northeast, which is a slight shift toward the east, more so than it is going at this time. So it will continue to move toward the island, making its entry on the southwestern coastline. We do expect, let me move this slide forward a little bit so you can see and get an idea of where we're expecting it to move. First, let me just point to those circles that you're seeing on the image, where the center is located. The inner, I refer to it as the inner core, which is that orange area that's surrounding it, and then you have the outer band, of the greens that extend across the country, which is what most of us have been experiencing thus far. But the inner core that we speak of is that orange area that we expect to be making some impact on the island, and that's where the stronger winds are concentrated. Also, the heavier rainfall is in that general area. We did say that the system is a Category 5 hurricane at this time, and when it makes landfall, it is expected to still be a Category 5 hurricane. That means it will cause catastrophic damage, life-threatening damage. There is very little that can stop a Category 5 hurricane. And regardless of the where you are in the parish of Westmoreland or St. Elizabeth, if you are under the impact of those Category 5 hurricane force winds, you will be having significant difficulty even with infrastructure that's in the area. So ensure that you are in the strongest area that you can. The recommendation from the Hurricane Center is that you would have as many walls between yourself and the outside as you can, because it is important to reinforce yourself and to ensure that you are not left vulnerable to this system. We do expect that it will gradually be reduced in strength as it moves over the island. It will fall to a Category 4, maybe, and then Category 3 as it exits the country, possibly. But in the meantime, when it makes landfall, which is expected, as you can see in this image here, to be somewhere near parity in western St. Elizabeth, that's somewhat to the east of Black River. So it will most likely make landfall in the western part of St. Elizabeth rather than in the eastern part of Westmoreland. And then it will continue moving toward the northeast. That is the direction of movement that is expected. It will continue over the northern part of St. Elizabeth and then move into southern Trelawney. And the exit is expected to be somewhere in Trelawney rather than in St. Anne. It would be most likely in the eastern end of Trelawney rather than St. Anne, where it makes its exit from the island of Jamaica. Here we see the area, this area of orange shows the outer bands of this system, where we are expecting to be experiencing impacts, heavy rainfall right across the length and breadth of Jamaica, also strong winds across the island. The amounts of rainfall that we expect, we see here again, we indicated that we would have between 20 and 30 inches or 500 to 750 millimeters of rainfall affecting sections of the island. The area that is expected to be impacted mostly has been narrowed a little bit on the map. So you'll see that Jamaica's central parishes are most at risk and extending into the west of the island as well. And then some slightly lower figures are expected for the rest of the island, but still significant rainfall. 12 to 16 inches, 300 to 400 millimeters is nothing to scoff at. It's still a lot of rainfall, still expected to.
So, Zara, I mean, wow, the storm still hasn't hit yet. I mean, what on earth?
Yes, and guys, I'm really sorry, but I have to head into that news conference right now.
Yes.
So I'm so sorry that I'm going to
That's
have to
okay.
leave, but it is important that I go into it.
Yes,
Okay, so
absolutely.
thank you for
Well,
having
thank you
me.
for coming on, and perhaps we can touch bases with you later.
Yes. Okay,
Thank you,
take
darling.
care. Bye-bye,
Okay,
everybody.
good. So yes, obviously media is in the thick of this. I'm going to go ahead and continue to play the press conference so that you guys can get the latest official word from the Jamaican government.
Close to the eye of the system. The rest of the island, I mentioned the Category 5 hurricane force winds that will be experienced over parts of St. Elizabeth and Westmoreland going into Trelawney, but we are expecting tropical storm force winds over the rest of the country. And so we all should be experiencing or looking out for the experience of tropical storm winds right across the island. Here we see on our picture some of the areas that are expected to be mostly inundated from storm surge that is also expected to come onshore. And this would be in those bays and inlets. In the area of Black River, we expect significant storm surge, although the center is now expected to be somewhat of Black River, so this might have to be updated slightly, but Black River will also experience storm surge. Storm surge could get as high as 13 feet. That's high. 13 feet is a couple of stories high. And so you need to be very much prepared for that kind of activity if you're in any of those bays or inlets along the coast of St. Elizabeth in particular, and even going into Clarendon. So those traditional areas of storm surge impact, like Portland Cottage, Rocky Point, those are areas that, because of the geography, we are expecting still to experience some amount of storm surge in those areas, although probably not as significant as we would have in St. Elizabeth along the coast. So anywhere, even along the coast of Manchester, parts of Alligator Pond and, Treasure Beach area should also be looking out for that kind of activity, and going eastward as far as parts of St. Catherine. And that is basically the presentation at this time. I'm sure you'll have some questions that will bring out some more information later. Thank you.
Thank you so much, Evan. You heard it. It is strengthening and it is coming to Jamaica. I know we've been praying for it not to hit, but it is going to hit us. So we have to heed everything that Evan has just said. I'm going to ask if there are any questions for Evan before we go on to the others. Any member of the media? Okay, please go ahead. Do we have a mic, or you're just going to speak very loudly and I'll repeat it? I think the mic is coming. You can just speak and I'll repeat the question. Okay, so the question was, has the window now closed for those who need to make preparations, especially on the western side of the island?
We're very close. Thanks for the question, JIS. We are very close to the closing of that window. I mean, I would not actually say it's entirely closed because there are a couple things that you might be able to do right outside your doors that could reinforce your structures. If that is a possibility, when we have some level of calm, I have been hearing from persons in St. Elizabeth, in Manchester, who have indicated that they are getting quite some heavy rainfall and some strong winds, but there are usually some lulls, some periods of semi-calm that they can probably do something quickly on the outside and get back inside. So we would like to ask everyone to ensure that you keep yourself safe. Exercise extreme caution if you have to do anything immediately outside. But of course, as the system moves any closer, we will start to experience the eye wall of the system moving onshore, and then the eye will make its impact. And we do expect that that will occur by midday today. So during the latter part of this morning, after 11 o'clock, I would say let's not take any chances on the outside. Let's make sure that we are on the inside, so as this system makes its way here, we're not destroyed ourselves. Apart from the structures outside, we have to make sure that we save our own lives. Thank you.
Thank you very much, Evan. We're going to now move to Minister Darrell Vaz, who is our Minister of Energy, Telecoms and Transportation.
Morning, Jamaica. Prayers up. Let's start with JPS, which I know is on everybody's mind. The electricity grid has already been impacted by hurricane conditions, which have caused several power outages across the island. Several generation units, critical high voltage substations, transmission and distribution lines across the island have been forced out of service by the hurricane force winds and lightning. As a result, approximately 240,000 or 35% of JPS customers are without power. That's out of a possible 700,000. Mainly in the parishes of St. Elizabeth, Manchester, St. James, and Hanover. The status generation, there is adequate firm generation online to serve our customers. No renewables are available. As I said before, customers impacted, more than 75% of the customers in St. Elizabeth, Manchester, Hanover, and St. James are affected without electricity. The least impacted parishes, with less than 10% of customers impacted, St. Thomas, Kingston, and St. Andrew, and St. Catherine. The majority of hospitals continue to be supplied with JPS power, except those in Manchester and St. Elizabeth, such as Black River, Mandeville, and Percy Junior Hospital. But I can confirm that they are operating on standby power, generator power. There is no plan at this point to shut down the grid. JPS crews continue to respond and restore critical facilities and customers where it is safe to do so. In the meantime, JPS is reminding customers to stay safe and take precautions to protect life and property. And most importantly, stay tuned to official channels of information, which include government and JPS, for further updates. As it relates to our telcos, I'll start with Digicel. 26% of mobile network is offline, predominantly due to the widespread loss of power. There's a further 209 sites running on generators and 9 on batteries. For fiber to home customers, we are seeing 20% customers offline due to no power in their homes. As we see the most impacted areas, we will work with our crews to focus on those areas first. Even if commercial power is still to be restored, we will keep generators fueled and gas the sites back to keep them up and running. They're also confirming that also in aiding recovery, we are working with the SMA to increase our spectrum bandwidth channels, as we know from our experience from Hurricane Beryl that the mobile infrastructure will be recovered much quicker than the fixed. So just to indicate that I, this morning at 3 o'clock, signed licenses for additional spectrum for Flow, Liberty Caribbean, and I'm awaiting Digicel to give them the same. For Flow, I'm happy to say that Liberty Caribbean operators of Flow Jamaica and Liberty Business is committed to playing its part for Jamaica to recover quickly from the inevitable damage following the passage of Hurricane Melissa. Again, with the spectrum that they have received, they will be bringing a new innovation, mobile connectivity via satellite, and facilitates SMS and text messages to areas affected in the aftermath of the storm. So this partnership promises to seamlessly enable 4G LTE mobile customers to send texts to their family and friends, even when the local network services may be interrupted. So that's huge, very huge. And this collaboration with Starlink reflects a deep commitment to the Caribbean and protecting Jamaica. So we look forward for that. And we also look forward for Digicel to do the same, which will give us a lot more ability to communicate and to recover as quickly as possible. This one is the big important one now, and that is the airports. Based on my consultations with PACAL and the Jamaica Civil Aviation Authority about the timeline for the Norman Manley International Airport to accommodate emergency relief flights after the passage of Hurricane Melissa, the assumption is that the system will leave Jamaica by the end of today, Tuesday, October 28th, and that the impact on the Norman Manley International Airport is not extensive. Both PACAL and JCA will use tomorrow, October 29th, to inspect and clean up the facility and restore the test equipment that have been decommissioned to accommodate flights. These emergency relief flights could therefore be accommodated as early as Thursday, October 30th, 2025. Again, we are not sure what's going to happen with Montego Bay, who will face at least a lower category, possibly category 3. So we aren't able to say anything on Sangster, but we know that it could have potential disabling impact for that airport. The good news is that the Ian Fleming International Airport is being considered as a part of contingency planning. So it means that we could get into Ian Fleming with certain types of aircrafts, and that will help us significantly based on the distance between Ian Fleming and Montego Bay. Petrojam, following another meeting this morning of the refinery, Petrojam is turning its attention to deepening participation in the broader national multi-agency response. Fuel security plays a key role, as we know, and Petrojam is assuring that all 3 international airports, in addition to all airdromes, are at 75 to 80% capacity for aviation fuel. This will enable aircraft movement to resume immediately. In addition, Petrojam has 2 to 3 weeks supply of aviation fuel at its Kingston and Montego Bay storage facilities. So in accordance with international standards, we will follow strict safe storage and rigorous testing prior to reopening. Jamaica Civil Aviation Authority, the microwave system is in general is operational, with the exception of the links between Winchester headquarters and Catherine Peak, which is currently offline. All remote sites are operating on generator power. So this means that we will be able to accommodate relief flights, which the requests are coming in fast and furious. And as I said before, we spoke about Airports Authority. Finally, I'll just give an update on JUTC. And that was up to 9 o'clock last night, reporting 361 persons that were taken to shelters in several parishes. All road operations for JUTC ceased last night, with the exception of transport assistance being provided to essential services staff, such as hospital workers. JUTC's emergency standby teams remain in place at all depots. We will have some kind of disruption to some of the buses, because those buses that use CNG will not be able to be fueled immediately due to the fact that the plant has been decommissioned. But let me close by saying, once again, that government, as you have heard and will hear from Minister Mackenzie, we are dotting all the I's and crossing all the T's to make sure that we facilitate all that is required for the response that is going to come in relation to the rebuilding phase after this catastrophic hurricane. So I want to just say to you, those of you who are still not taking it serious, you have but a few hours. And as I said before, based on what Evan said, the low-lying areas are going to be badly affected. Seek to go to higher ground and protect yourself and be smart. Again, commit to be here right through. And of course, if we work together, we will get through this once again. God bless Jamaica and keep safe.
Thank you very much, Minister Vaz. As you hear, we have not stopped working. He's not going to stop working to ensure that we have electricity and that we have telecom service. Right before this press briefing started, I heard him on the phone with JPS's head, and they were talking through how they were going to be making sure that we have electricity up in areas that aren't as badly affected, and then that we can recover even more quickly. He has not stopped working for us, and we have to obviously thank Starlink for that support that they're giving to our telecoms providers in Jamaica to ensure that even if our systems locally go down, that we will still be able to communicate internally and externally with the rest of the world. Also want to welcome the members of the media who are joining us from overseas. I know that the feed is going out also. We say good morning to you and good morning to all of your viewers out there too. Next up, we have Minister Desmond Mackenzie, who is not just our Minister of Local Government and Community Development. He is the one that's coordinating the entire disaster response, wearing his hat as the Deputy Chair of our National Disaster Risk Council. The chair is the Prime Minister, who is very much behind the scenes coordinating all of this and calling all of us for updates. And so this morning you will hear directly from Minister Mackenzie his updates on the entire disaster management framework.
Thank you, Minister Dixon. Again, let me commend you on the sterling job that you've been doing in presiding over these very important press briefing. Minister Vaz, Evan Thompson, my PS, Director General Acting, other support staff, and I want to acknowledge the team. The Jamaica Fire Brigade and the GADF was very active last night, responding to a number of calls to assist residents in sections of the corporate area. I want to, first of all, give an update on the state of shelters. Again, I want to repeat that all of the 800 and odd shelters are open. The numbers that I have presently speak to, of the 800 shelters, 382 shelters are occupied so far, with with a total of persons within these shelters of almost 6,000 persons. Just to give you a rundown of the numbers in Kingston and St. Andrew, there are 45 shelters which are open with 581 persons. In Clarendon, 39 shelters with a accommodation of over 865 in Clarendon. Westmoreland, 33 shelters open with over 500 persons. St. Mary, 27 shelters with over 500 persons. St. Catherine, 27 shelters, 394 persons. Portmore, 8 shelters, 74 persons. St. Thomas, 18 shelters, 609 persons. Manchester, 23, 135. St. Anne, I see here 18 shelters open, but 0. There seems to be no one in any shelters in St. Anne. We'll check on those numbers. And over 19 shelters are open with over 261 persons. St. James, 30 shelters, 209 persons. Trelawney, 10 shelters, 313. Portland, 59 shelters, 541. St. Elizabeth, 26 shelters, 289. Now, St. Elizabeth is of concern because I am understanding that we are getting calls before we came on here of persons in St. Elizabeth asking for transportation to be sent into various communities to transport persons out of those areas. As Minister Vaz have said, it is going to be difficult. I have given instructions to the RPM director and to the team to advise the disaster coordinators and the members of parliament and the mayors wherever transportation is needed and they can get those transportation, they should do everything that is possible to provide the transportation to take the people out. But the system that we have had, as Minister Vaz said, those systems have been put on hold now because of the closeness of the system. So I would urge persons who can move to do so, and the mayors and the CEOs and the councillors and the members of parliament to do everything that is possible to assist those persons in moving. The impact of Melissa is being felt. Evan gave full details. We are having reports of widespread impact across several parishes which are seeing increased number of land slippage, flooding, fire, storm surge, and power outage. Roads in St. Thomas, Portland, and St. Catherine were blocked by fallen trees, poles, landslides, and most of these have been clear. And I want to make the point that the team that are on the road, the roving teams that have been pre-positioned, have been responding. Once the report is sent to the team, they are out there actually doing the work. So if you are in an area where there is blockage and fallen trees, you can send us the information, and once that is possible, we will send the team out. Minister Vaz, I see a report here, fire and GPS pole lines in certain sections. Storm surge affect Old Harbour Bay and other such communities. Caribbean Terrace is experiencing flooding, and I want to say that that is a community that I think we have to pay more attention to, because many years ago, when I was mayor, a section of Caribbean Terrace was devastated, and we are now seeing again based on the information that is coming, and I'm going to ask the team to do some more checking to see the extent of what is taking place in Caribbean Terrace. We are experiencing, as I said before, land slippage in many communities in Portland, St. Thomas, St. Elizabeth, St. Thomas, and many other communities are experiencing those challenges as I speak at this time. This is the last briefing that we'll be able to give as update, but I will spend 2 minutes again. God has been merciful because we've been talking about Melissa coming for almost a week. And still today, when we are expecting Melissa, there are still, as Evan have said, a small window of opportunity. Let us use it and use it wisely. Let us respond. I hope by within the next hour, when I get an update, I will see more persons in shelters and we will see more people responding. Jamaica, this is not the time to be brave. I've been saying for 1 week, don't bet against Melissa. It is a bet we can't win. I want to close because the reports is short and we want persons to go to do what they can do for themselves, their families. And I want to thank all of you who have left your homes and have been spending time here, camping out, members of the media. Last night I walked and I interacted with them before I went to bed in my little corner. And, you know, it was commendable to see the media and other support staff leaving their families and things. And this is a commitment that we are making for the betterment of Jamaica. Already we have started, as I said from yesterday, to look at how we're going to map our recovery. We have to start to look at that. We can't wait until Melissa has come to start to say how we are going to prepare ourselves for the recovery. We have started to do that in the meetings that we have been having. But I want to thank the team. And I know that Jamaicans are grateful. And we are all praying for the best outcome. So as I said before, whatever windows are available, I am asking those, especially in St. Elizabeth and those areas, who can move to do so at this time. Thank you.
Thank you, Minister Mackenzie. I just wanted to note, given that we have a lot of our members of the diaspora on, you've been asking a lot about how you can support Jamaica. Just noting that I'm very, very pleased this morning to announce the launch of our Support Jamaica website. It is supportjamaica.gov.jm. We've already been made aware of some nefarious individuals trying to collect money on behalf of Jamaica. We remind you that this will be the official site. If it doesn't have .gov.jm, it is not legitimate. It's not an official Government of Jamaica site. And so it will be supportjamaica.gov.jm, and it will be our online platform developed by the Government of Jamaica to mobilize support, to channel relief and coordinate recovery efforts in the wake of Hurricane Melissa. In it, you're going to have a donate now page where you can donate using your credit or debit cards, and you will also be able to give pledges. You also have all the information on ODPEM's bank accounts. If you want to do a bank transfer, you can do so there. A new innovation on that site is that you will be able to give updates on emergencies. So if there's an issue that you see in your area, you want to upload a picture, maybe there is flooding, maybe there is a town that has been cut off, you can actually notify us through that website also. It also has an interactive shelter locator for those who may need it. Even if you have to help someone to find a shelter, please use it. It will give you all the shelters that are near you. You can actually put in what parish you're in or what area you're in, and you can geolocate. Oh, thank you. Thank you, Tony. All right. We had a quick power outage, but we are back up here. Just noting again that you can find shelters. They are on that site, supportjamaica.gov.jm. And so it is all about mobilizing resources. So it's a resource for those locally and also for those in the diaspora and anywhere in the world that wants to give support to Jamaica. Again, the website is supportjamaica.gov.jm, and it was created overnight, updated in basically a day. The developers spent a day working on it, and we want to thank them. And it was donated to us by Amber Group in consultation with other members of the team and other private sector partners. We are going to be opening up now for questions from the media. I know I already have one question that I need to treat with, which has to do with tourists. How many tourists are here on the island? The number I have from the Ministry of Tourism is 25,000. They issued a press release yesterday, and they noted that they are coordinating with all of the hotels. There's no need to worry. The Ministry of Tourism has its center that is in constant communication with all of the hotels, has been providing support, and so we are keeping those tourists as safe as we possibly can. And so I open up for questions. Zara, you're first.
Good morning, everybody. Zara Burton representing Reuters today. I would like to know, please, I realize that it is still early to talk about this, but I'm just curious if it is that, there could be any kind of comment about, search and rescue preparation. If there could be any kind of comment about if it is that you are in this hurricane and your shelter is compromised. Is there any advice on, I don't know if ODPEM can give any advice on safe rooms to go to, just any practical advice to residents who may be in this hurricane and in very perilous situations during and post?
Thank you for that question, and we're going to get you an answer.
Let me say that the Jamaica Defense Force and the Jamaica Constabulary Force are members of the National Disaster Committee, and they sit in the command center during the operation. So any request that comes in for search and rescue will be undertaken by the Jamaica Defense Force along with the Jamaica Fire Brigade, because they are a part of the national response team, and they are present, and we have equipments that are pre-positioned prior to the passage of Melissa that will be able to respond. So in a nutshell, yes, we are in a position to respond, and once the request comes in, the team will be ready to go. We have boats, helicopters, you name it. The government has equipped the Jamaica Defense Force, especially with a number of helicopters. The Jamaica Fire Brigade have a number of boats that can be used on land and can be used at sea for rescue operation and search operation.
Minister, I think there were some questions around tips, I think, between you and Mr. Thompson in terms of tips for persons. I know you're an expert in this area.
Thank you, Minister. Very difficult in terms of tips for Category 5, but nonetheless, I think one of the things that we have to do is to ensure that, as was said before, that we are doing most of the preparation going in. In terms of tips, we have always said that person should try as best as possible to bring a lot of stuff already outside, inside. We don't want a lot of stuff that you have loose stuff outside, especially Minister spoke it about construction sites. A lot of those things can be used as missile in the system, so you try to bring a lot of those in as best as possible, try to secure your animals. If you're inside, you stay in between walls that are not close to your outer walls in terms of your structures, because if your structure is not sound enough, those will go. A little bit better, I think, for persons who have
multi-story facility. If your roof goes, you can go on the lower part of your your building. Search and rescue component, the minister said it before. The teams are out there, but what we are saying in terms of tips as well, which was said before, and I will enforce it again, get into the shelters, because in terms of search and rescue, we can't do search and rescue in the heights of a system. Persons need to get away from the coastline, away from low-lying areas that are prone to flooding, and ensure that you are in safe, elevated areas to ensure that you are safe from all the dangers of coastal waters and riverine waters. And as best as possible, ensure that on the inside of your property, you're staying in between double walls. So if your outer wall goes, you're a little bit protected, and stay downstairs if you have a multi-story facility. Thank you.
Okay, thank you, Mr. Thompson. Thank you, Minister Mackenzie. I think we're going to go to Nationwide News now.
Yes. Good morning, everyone. Mahiri Stewart, Nationwide News. Question for Minister Vaz. You oversee the energy, telecoms, and transport portfolio. Have you been receiving any reports of vandalism in any of those three sectors?
Thank God, nothing so far, and I hope it remains that way. Nothing so far.
All right, Television Jamaica.
Yes, Minister Vaz, Andrea Chisholm from TVJ. Quickly checking on the JUTC buses. I think you mentioned that the CNG plant has been decommissioned. So I'm thinking that 60 or so about of the 93 buses that came in operate on CNG. So do you have enough CNG in place to operate those buses for a while, or is it that they're totally out of use for now?
Yes. Prior to the hurricane and in preparation for the hurricane, one of the requirements was for additional storage to be on location in case deliveries are not able, because the deliveries are done by road. So we took that into consideration. So I'm hoping that the plant will be able to be recommissioned in short order, but there may be, depending on the level of damage, some disruption in terms of the full fleet, but we will have enough to do what we need to do.
Nationwide once again. Question to Evan Thompson. We know the effects that we're expecting in terms of the hurricane force winds and the tropical storm force winds on the outer side of Melissa, but in terms of the eye, because that's obviously going to pass through the country as well, what kind of conditions can persons expect during the eye of the hurricane? I know things are kind of calm now in certain areas. Are those persons within the eye supposed to expect similar conditions?
Thanks. That's a very good question, Mahiri. It's important for us to understand what happens when the eye is expected to move across your area. First of all, the eye itself is a calm area in the center of the storm. So as that moves over, it will appear as if it's all done. It will be a clearing. There will be very little cloud cover. There will be very little wind. And so it will feel as though the storm has passed. And it's a good feeling. And so a number of persons would want to take the opportunity to get some quick repairs done, especially since the eye extends a few miles actually in diameter. So, it would take a little while to pass over you, and you could have some time of break. But before the eye gets to you, you would have passed through one of the most intense parts of this hurricane. It means that you will experience wind speeds that are approaching 300 kilometers per hour. This is round about 185 miles per hour. That's what the system is packing as a Category 5 hurricane. And much of that will be within the eye wall. in that eye wall, which is that area that surrounds the eye, you will have that most intense wind speeds, but also the most torrential downpours of rainfall. So that area will pass from the coast right across as the eye moves. Of course, that is the protective area for the eye that moves along with it, all the way from the southwest of Jamaica to the north central part of the island. So you will experience those intense conditions before the calm. And then after that calm, you experience it once again, unfortunately, and the winds will be from the opposite direction. So if it was coming to you from the east, it will now come to you from the west after the eye. If it was from the north, it will come from the south after the eye passes. It's always from the opposite direction after the eye passes, and you have to prepare yourself for that.
All right, so my question has to do with lightning strikes, because in one of the models that you showed us, I believe it was yesterday, we saw quite a few areas of thunderstorms. So I'm not certain what you can tell Jamaica now in terms of preparing or protecting ourselves from the possibility of being struck by lightning. And what do we look out for ahead of it? What are the signs?
Yes, lightning frequently occurs during the thunderstorms. Of course, it does occur during thunderstorms. And thunderstorms will be part of that intense area of the shower activity. We don't expect anyone to be outside, really. So that should, of course, protect you from the lightning strikes to a large extent. Of course, there will be some impact. It will affect electricity supply. It could also be the cause of fires. And so it's important that that is also monitored. I'm sure the fire brigade is alert to that, that there could be fires that are generated because of the lightning strike. So that is one of those hazards that actually accompanies hurricanes as well. We don't talk much about tornadoes either, but actually we do have small tornadoes that develop in hurricanes. And that is something that people need to also be aware of. Whenever hurricanes move over, generally you have those smaller scale cyclonic events that are tornadic. Well, tornadoes develop within these systems, and that could also be a source of danger for residents as the system passes over. They don't last very long for our area, but they are a real possibility. Not just a possibility, they actually occur and have occurred in Jamaica in the past.
Possible for particular parishes more so than others, considering where this system is projected to travel?
I believe in most cases when you have those events, it would be in the lower lands, in the flatter lands, and not so much in the hilly terrain. However, we should be prepared. I mean, in the larger scale of things, we're dealing with a hurricane with huge winds, massive winds, but at the same time, you could have the resultant effect of additional with the smaller scale events taking place within it.
Thank you.
Another quick question to Mr. Mackenzie. You were clear, Mr. Thompson. Thank you. Very quickly, Minister, you mentioned that the JDF and JCF were responding to calls in the corporate area. Just trying to get some details on that. Is it that persons were now evacuating or any flooding or anything?
No, not anything major. Just assistance that was required of them, and they have responded as they would normally do. Because remember now, the command center carries every critical area of government that forms a part of our disaster response mechanism. So once the information is fed into the command center, we will go out to see what is required in terms of why a request was made. And that was why the team was out. And we have roving teams on the road that is driving around. So when they pick up anything on the road, they will act, and they will call in and give central the information, and we will log those information, because we use the information after to see what took place and how best to address and to see how we can prevent. Yes.
And question from Nationwide: Have you been updated in terms of the readiness and the preparation for places such as prisons, children's homes, and homes for old persons?
Well, as I said before, the security forces sit on the National Committee. So everything security-wise, and we don't discuss the security aspects of the prisons and the operations of the police and the military, because that is confined, and you know why that has to be confined. The Ministry of Labor and Social Security, we work with all the ministries are involved. So children homes and the infirmaries and everything is taken care of in the general scheme of things and planning. And inspections are done to these facilities to ensure that they are up to standard.
Ask you one more question. Could you just comment on why it is that at first we were facing a multi-day event, and now you're saying by this evening it will go? Could you just at least address that little thing?
All right, we're going to have to, this has to be the last question, because we do have to get the teams who need to get home safely. And so this is the last question. And I think you had answered it, Evan, before, but come.
Yes, this event has been multiple days that we've been experiencing it. This passing of the passage of the eye across the island will not be a full day. However, the entire event, we've been experiencing this for over a week, and this is part of the system that has been impacting us. It has been for a few days already and will continue for another few days, because after the eye passes, we will have another maybe 2 days before we actually see a clearing. All right? Thank you.
Thank you very much. So we are at the end of this press conference, just reminding everyone that if you want to support, we have international media that's streaming this live. If you want to support Jamaica, please go to supportjamaica.gov.jm. We're already receiving reports of flooding in St. Elizabeth. So all of you who are on the path that Evan has given us, please make sure you are getting to safety. It is becoming late to get to safety. The entire country is going to be affected. But as we said yesterday, we know we will get through this. Evan has said that this cloud and this wind and this rain will last for a couple of days. But after that, we will rise again as a resilient Jamaican people. And so as we leave today, we continue to pray for this beautiful country. Pray for those who are in the path of Hurricane Melissa, that God will guide them and God will keep them safe. Thank you all, and God bless Jamaica, land we love.